Vein treatments. Understanding how vein ablation or Varithena can combat venous insufficiency and restore your active lifestyle. Were you diagnosed with chronic venous insufficiency or CVI? Explore your next steps. With the proper treatment, the progressive symptoms associated with CVI can be addressed in a few ways. When non-invasive treatments such as compression stockings and Normatec therapy have failed, it may be time to consider other treatment options. Vein ablation. Understanding the procedure. The vein ablation procedure uses heat to close the damaged or weakened vein, which redirects blood flow to healthy veins, consequently relieving symptoms. This procedure does not need to be performed at a hospital and can be performed under local or general anesthesia. First, general anesthesia or a numbing agent is administered, making this a virtually painless procedure. Next, using ultrasound guidance, your doctor positions the catheter into the diseased vein. The small catheter delivers heat to the vein wall, causing it to shrink and seal closed. Once the diseased vein is closed, blood will reroute itself to other healthy veins. Following the procedure, a bandage is placed over the insertion site. Additional compression may be provided to aid healing. Varithena. Understanding the procedure. The Varithena procedure involves administering an injectable microfoam that, much like vein ablation, closes down the damaged or weakened vein and diverts blood flow to healthier veins. This procedure can be completed in office with as few as 1 to 2 needle sticks and is covered by most Medicare and insurance plans. First, your provider will use a local numbing agent to numb the injection site. There is no need for general anesthesia, sedation, or narcotic medication. The microfoam medication is injected into the diseased vein, acts on the vein wall, and causes the vein to collapse. The procedure is repeated on all veins that need treatment. Once the diseased veins are closed, blood will reroute itself to other healthy veins. Following the procedure, a bandage is placed over the insertion site. Additional compression may be provided to aid healing. Benefits of these procedures: minimally invasive outpatient procedures, long-term treatment options, covered by insurance. Procedures take less than 20 minutes to an hour. General anesthesia is optional. Walk out of the procedure and back to full activity the following day. Common myths. Myth: I am too young for blood flow circulation issues. Fact: chronic venous insufficiency often starts in our 20s and 30s and progresses over time. Myth: if I don't see varicose veins, there isn't a problem. Fact: diseased veins do not have to be seen on the skin surface and are oftentimes visualized on ultrasound. Myth: vein conditions only affect females. Fact: venous insufficiency is found in both female and male patients. Myth: I need to go to a radiology center or hospital to find out if I have chronic venous insufficiency. Fact: most imaging centers only look for blood clots. At Alliance Orthopedics, our ultrasound technique looks for blood clots and evidence of CVI. Myth: vein conditions are only a cosmetic issue. Fact: CVI can lead to cosmetic issues but may present as leg pain, fatigue, and cramping without any cosmetic signs. Visit us online at allianceortho.com or give us a call at 201-509-8600 to begin your journey to a pain-free lifestyle with Alliance Orthopedics.